If you think you, or someone in your care, are having an anaphylactic reaction, call for help immediately. Follow these steps. Get into the best position to use your Jext. Lie down with your feet raised, unless this makes you breathless. If you are breathless, you should sit up. If you are a parent or caregiver administering Jext to a child, it is important to hold their leg in position so that you can administer Jext correctly into their outer thigh. Unconscious patients should be placed in the recovery position. Remove the Jext from the carry case. Grasp the Jext in your dominant hand, the one you used to write with your thumb closest to the yellow cap. Pull off the yellow cap with your other hand. Place the black tip against your outer thigh, holding the Jext at a right angle, approximately 90 degrees to the thigh. Jext has been designed to inject through the clothes, but do try to avoid zips and buttons. Push the black tip firmly into your outer thigh until you hear a click confirming the injection has started, then keep it pushed in. Hold the Jext firmly in place against the outer thigh for 10 seconds, a slow count to 10, then remove. The black tip will extend automatically and hide the needle. Massage the injection area for 10 seconds. Seek immediate medical assistance. Dial your local emergency number. Ask for an ambulance and say anaphylaxis even if symptoms appear to be improving. Conscious patients should continue to lie flat with feet elevated, or sit up if you are having breathing difficulties. Unconscious patients should remain on their side in the recovery position. If possible, ask someone to stay with you until the ambulance arrives in case you feel unwell again. You can only use each Jext once. For this reason, it is recommended that patients are prescribed 2 Jext, which they should carry with them at all times. If you are not feeling better, or if you begin feeling worse, a second injection with an additional Jext may be administered 5 to 15 minutes after the first injection, following the same steps as for the first injection. When the ambulance arrives, inform the healthcare professional that you have received 1 or 2 injections of adrenaline and hand the used Jext to a paramedic or ER department. Following use, you should see in the inspection window on the label a coloured plastic rod visible. White injects 300 micrograms and blue injects 150 micrograms to confirm that the Jext is activated and the adrenaline solution has been injected. Are you Jext ready? Like all adrenaline auto-injectors, your Jext is a life-saving device, and so it's important to keep it safe. It is recommended that your family members, carers or teachers are also instructed in the correct use of Jext. 1. Always keep your Jext in the hard carry case it was supplied in. Store below 25 degrees and never let it freeze. 2. Regularly check the adrenaline. You can do this by looking through the viewing window in the middle of your Jext. The adrenaline liquid should be clear and colourless. If it is not, then you should replace your Jext as soon as possible. 3. Keep on top of expiry dates. Each Jext has an expiry date that is printed on the label. Be sure to order a replacement before it expires. The company that produced Jext make this easy with a free expiry alert service. If you don't feel any better after your first injection, or if you start to feel worse, a second injection with an additional Jext may be administered 5 to 15 minutes after the first injection. For this reason, you should carry more than 1 Jext with you at all times. You can use the Jext trainer to teach yourself how to use Jext. The Jext trainer is just like the real Jext except for 3 things. It doesn't contain any adrenaline, it has no needle, and it can be used repeatedly. You can order a free Jext trainer through the Jext website or the Jext app. And remember, it is important to keep your knowledge up to date. Please refer back to this video at regular time periods to ensure you are always Jext ready. Download the free Jext app for life-saving anaphylaxis support in the palm of your hand, 24/7, and the many other helpful resources it provides. For more information, visit www.jext.com.